So here I'm in my clinic. This is my happy space. This is where I see patients with neurological disorders, particularly neurogenetic disorders. Mitochondrial disease, a genetic disease that robs the body of energy. We have the largest clinic here in Australia for patients with mitochondrial disease. And I think research really makes me a better clinician. It helps me pursue that standard of excellence. Patients come with the problems that we have to solve and treat as a clinician. We can then take those problems into the laboratory, do experiments to understand how those problems are occurring, find the solutions, and then bring it back to the bedside and deliver it back to the patient. The Kolling is all about translational research. We are there to solve medical problems and to make our discoveries come into reality. I was walking with my postdoc from the laboratory just before we came to clinic. We counted it was 35 paces from the Kolling building to the hospital itself. Another minute or two later I was in the clinic. And so we have this physical closeness which is symbolic of the connections that we have between the clinical space and the research space. Really, it's impossible to obtain tissue from a patient's brain to do our experiments on. So what we do is we use stem cell technologies. What that means is that we take a cell, either blood cells or skin cells. We then take that into the laboratory, reprogram that cell to remember how to become a stem cell. Every cell in the body can become a stem cell. That stem cell from which we were born can remember how to become that stem cell again. It's personalised medicine, absolutely. We take our patient cells and then we can use that material to understand the problem that's affecting that individual. So at the moment, genetic testing is not freely available. So patients with genetic disorders often search for their diagnosis for many years. Once they have the genetic diagnosis, we can actually tailor the treatment. Again, this is all about precision or personalised medicine. When they are planning their families are at risk of having that disease. And so having a precise genetic diagnosis actually helps us to advise them how they can plan their families without having children at risk.